What your skin is warning you about your health. Your skin, the body's largest organ, acts as a window to your internal health, revealing clues about what's happening inside your body. Often, it's the first place to signal that something is amiss with your health. From sudden rashes to persistent changes in texture or color, the skin may serve as a visible warning system for a variety of conditions. Understanding these signals may be key to the early detection and treatment of many health issues. In today's video, we will delve deeper into the 10 warning signs that your skin may subtly tell you about your inner health. One thing to keep in mind is that before making significant alterations to your diet, you should always consult a registered dietitian. Also, stick to the end of the video, where we will highlight the daily habits that may help you protect your skin health. Hence, keep watching. 1. Yellowing skin jaundice. Jaundice, characterized by a yellow tint to the skin and eyes, serves as a crucial indicator of liver health. This condition originates from bilirubin, a yellowish pigment formed during the breakdown of old red blood cells. Under normal circumstances, the liver processes bilirubin by conjugating it, making it water-soluble, and then excreting it in bile. However, the liver's capacity to handle this pigment deteriorates in cases of hepatitis, viral inflammation, toxins, or autoimmune diseases. In more chronic scenarios, such as liver cirrhosis, the liver's tissue becomes scarred and its architecture is restructured, hindering its filtering capacity. Similarly, gallstones, which are hardened deposits that may form in the gallbladder, may obstruct the bile ducts, preventing bilirubin from being excreted from the body. This leads to its accumulation in the bloodstream and, subsequently, the skin and eyes, giving them a yellow hue. Although many sources confidently say that jaundice may be recognized when the serum bilirubin rises to 2 mg per deciliter, experienced clinicians often cannot see a yellow skin coloration until the serum bilirubin is at least 7 to 8 mg per deciliter. Approximately 30 grams of nuts may provide essential fatty acids and vitamin E, aiding in liver protection. However, it's crucial to balance nutrition and not exceed these amounts, as excessive intake may lead to other health issues. 2. Dry, itchy skin eczema or thyroid issues. Persistent dryness and itchiness of the skin may be indicative of underlying health issues such as eczema or hypothyroidism. Eczema, or atopic dermatitis, arises from an overactive immune response, leading to inflammation and a compromised skin barrier. This condition causes the skin to become inflamed, itchy, and overly dry as the protective outer layer is unable to retain moisture effectively. On the other hand, hypothyroidism, characterized by an underactive thyroid gland, leads to a slowed metabolism, affecting various bodily functions, including the rate at which the skin regenerates and retains moisture. As a result, individuals with hypothyroidism often experience dry, flaky, and irritable skin. The most common cutaneous feature in patients with hypothyroidism was coarse, rough, dry skin, seen in 100% of the patients. In addition to dietary adjustments, maintaining overall skin hydration through regular moisturizing, avoiding harsh soaps, and using humidifiers may alleviate dryness and irritation. While diet plays a crucial role in managing these conditions, it is part of a broader treatment plan that includes medical advice and potentially medication for thyroid regulation or immune modulation. 3. Butterfly rash, also called lupus. The butterfly rash, a distinctive marker of lupus, epitomizes how the immune system, when misdirected, may manifest visibly on the skin. Lupus is an autoimmune condition wherein the body's defense mechanism erroneously targets its tissues, leading to widespread inflammation and a variety of symptoms, the rash being one of the most recognizable. This rash spans the cheeks and bridge of the nose, mirroring the wings of a butterfly. In a study on lupus patients, 30% initially presented skin lesions, but all developed them over time. Key findings included lupus-specific lesions like malar rash and photosensitive dermatitis. In this disorder, the immune system produces antibodies that, instead of defending against foreign entities like bacteria or viruses, attack the body's own cells, leading to inflammation and tissue damage. When this misguided attack involves the skin, it results in the characteristic rash. Additionally, the inflammation may extend deeper, affecting organs such as the kidneys, brain, heart, and lungs, which underpins the systemic nature of lupus and its classification as a systemic inflammatory disease. Avoiding pro-inflammatory foods is equally important. This includes reducing the intake of processed foods, saturated fats, and sugars, which may exacerbate inflammation and potentially trigger lupus flare-ups. Additionally, certain lupus patients might find they are sensitive to foods containing gluten or high levels of salt and should adjust their diets accordingly under the guidance of a healthcare professional. 4. Dark patches. The appearance of dark, velvety skin patches, medically termed acanthosis nigricans, primarily in body folds such as the neck, armpits, and groin, is often a visible indicator of insulin resistance. This condition acts as a harbinger of type 2 diabetes, representing a critical juncture where the body's ability to regulate blood sugar begins to falter. In cases of insulin resistance, the body's cells become less responsive to insulin, the hormone responsible for transporting sugar from the bloodstream into cells for energy. As a result, the body compensates by producing more insulin. High levels of insulin in the bloodstream may activate insulin-like growth factor receptors on skin cells, leading to their rapid growth and the ensuing dark, thickened patches of skin. This symptom serves not only as a cosmetic concern, but also as a tangible sign of underlying metabolic disturbances. Specific dietary recommendations include incorporating foods with a low glycemic index, such as leafy green vegetables, nuts, seeds, and whole grains, which help maintain stable blood sugar levels. Regular consumption of these foods, within the context of a balanced diet, should adhere to daily recommended intakes. For grains, aim for 3 to 5 servings per day. For legumes, incorporate a serving approximately half a cup daily. And for nuts and seeds, but limit to a handful to avoid excessive calorie intake. 5. Bruising or red spots, blood disorders. Excessive bruising, or the appearance of small, red spots known as petechiae on the skin may serve as critical indicators of underlying blood disorders such as leukemia or platelet disorders. Normally, platelets, tiny blood cells, help wounds heal and prevent bleeding by forming blood clots. But if platelet levels are low or if there are not enough clotting factors, the clotting process is slowed down. This can cause excessive or strange bruises or the appearance of petechiae. These tiny red spots are actually minute blood vessels that have ruptured under the skin. Leukemia, a type of cancer affecting the blood and bone marrow, may lead to a decrease in healthy blood cells, including platelets, due to the overproduction of abnormal white blood cells. This imbalance impairs the body's clotting abilities and immune responses. In contrast, specific platelet disorders may result from inherited conditions, medications, or other diseases that either reduce platelet production or increase platelet destruction. Moreover, there is also porphyria cutanea tarda, a disease that leads to painful blisters when the skin is exposed to the sun. In a study, 21 participants described their varying experiences, from mild skin fragility to severe conditions with large blisters and skin shedding, likened to being in a horror movie. Foods rich in vitamin K, such as kale, spinach, and Brussels sprouts, should be in one's diet. Additionally, foods high in iron, such as lean red meat, beans, lentils, and fortified cereals, may support the production of healthy red blood cells and contribute to overall blood health. 6. Psoriasis. Around 60 million people globally have psoriasis. It has immune system-related causes and is partly genetic, so it might run in families. Psoriasis is linked to other health problems, including joint issues, psoriatic arthritis, heart and liver conditions, and mental health challenges. Psoriasis is characterized by the development of thick, scaly patches on the skin, particularly noticeable on the elbows, knees, scalp, and lower back. Under normal circumstances, skin cells mature and are shed from the skin's surface roughly every month. However, in psoriasis, this process is dramatically accelerated, occurring over just a few days. Consequently, the cells don't have enough time to mature or to be naturally shed, leading to the characteristic buildup of thick, inflamed and scaly patches. It also contributes to the redness, swelling, and discomfort associated with the patches. However, it's also important to note that certain foods might trigger psoriasis flare-ups in some individuals. Common triggers include red meat, dairy, gluten, and alcohol. 7. Persistent redness, rosacea. Painful blisters on the skin or mucous membranes may be a sign of Pemphigus vulgaris, a rare and severe autoimmune disorder. In healthy individuals, these proteins ensure that skin cells adhere tightly, creating a protective barrier. However, in Pemphigus vulgaris, antibodies produced by the immune system disrupt this cellular bond, leading to the development of blisters. These are not just superficial but may occur deep within the skin layers or mucous membranes, causing significant discomfort and, in some cases, leading to infections or further complications. A meta-analysis showed that the prevalence of rosacea is about 5% in the general population and 2% in dermatological outpatients. This skin condition affects women slightly more frequently than men and decreases with age. Furthermore, a diet rich in antioxidants from fruits and vegetables may support the immune system and reduce oxidative stress, which is often elevated in autoimmune disorders. While there is no specific limit to the consumption of fruits and vegetables, aiming for a variety of colors and types, equivalent to 5 to 9 servings per day, may provide a broad range of nutrients and antioxidants. 8. Skin tightening. Scleroderma represents a complex group of autoimmune diseases characterized primarily by the hardening and tightening of the skin, particularly on the hands, face, and forearms. This condition stems from the overproduction and accumulation of collagen in the body's connective tissues. Collagen is a key structural protein that, under normal circumstances, supports and strengthens our skin and connective tissues. However, in scleroderma, the immune system triggers an abnormal, excessive production of collagen, leading to thickening and stiffening of the skin, and in more severe cases, affecting internal organs like the heart, lungs, kidneys, and gastrointestinal tract. Scleroderma is mostly seen in women whose ages are between 30 and 50, and its prevalence is 250 cases in a million. For individuals with scleroderma, particularly those experiencing gastrointestinal issues, a balanced diet rich in fiber may aid digestive health and alleviate symptoms like bloating and constipation. Foods such as whole grains, legumes, fruits, and vegetables are beneficial, with a general recommendation of 25 to 30 grams of fiber per day. 9. Blistering skin, Pemphigus vulgaris. Pemphigus vulgaris is a rare disease that causes blisters. It is the most common type of pemphigus. The mean age of onset is 50 to 60 years of age, and it affects both sexes equally. This distressing condition occurs when the immune system erroneously targets desmoglins, which are specific proteins critical for the adhesion between epidermal cells or keratinocytes. These proteins act like glue to keep skin cells together. When antibodies mistakenly attack these proteins, it leads to a breakdown in cell adhesion, resulting in the characteristic blisters of Pemphigus vulgaris. For individuals with Pemphigus vulgaris, incorporating these foods into their diet could potentially help manage inflammation. It's advisable to consume fatty fish 2 to 3 times per week, and to include a small handful of nuts or a tablespoon of flax seeds daily. Avoiding spicy, acidic, or hard foods may prevent further irritation to the blisters and facilitate the healing process. 10. Nail changes. Alterations in the appearance of nails may serve as visual cues for underlying health conditions, providing a unique window into the body's internal state. For instance, nails that turn yellow might often be attributed to fungal infections, where the fungus invades the nail bed, causing discoloration, thickening, and sometimes a crumbling texture. Clubbing, another nail condition, involves the thickening of the fingertips with nails that slope downward more dramatically than normal. This change is often a sign of chronic low oxygen levels in the blood and is associated with various types of lung disease. Moreover, koilonychia, often known as spoon nails, is when the nails become concave or scoop-shaped, dipping in the middle instead of curving outward. It may be linked to various health issues like iron deficiency anemia, part of Plummer-Vinson syndrome, poor nutrition, excess iron in the body, hemochromatosis, heart disease, thyroid problems, and stomach cancer. A diet low in refined carbohydrates and high in vegetables, lean proteins, and healthy fats may support the body's antifungal efforts. While there's no strict daily limit for sugar, the American Heart Association recommends no more than 25 grams per day for women and 36 grams per day for men. How should you protect your skin? Protecting your skin health involves a combination of daily habits that shield against external damage while nurturing the skin from the inside out. 1. Sun protection. Overexposure to the sun may cause wrinkles, age spots, and increase the risk of skin cancer. Use a broad-spectrum sunscreen with at least SPF 30, wear protective clothing, and seek shade, especially during the sun's peak hours between 10 a.m. and 4 p.m. 2. Hydration. Drink plenty of water throughout the day to keep your skin hydrated from the inside out. Additionally, use a hydrating moisturizer suited to your skin type to help maintain its natural moisture barrier. 3. Healthy diet. Antioxidant-rich foods may help combat skin damage, while omega-3 fatty acids may reduce inflammation. 4. Avoid smoking. Smoking contributes to wrinkles and may make your skin look older. It narrows the tiny blood vessels in the outermost layers of skin, decreasing blood flow and making skin paler. 5. Limit alcohol consumption. Alcohol dilates the pores of the skin, leading to blackheads and whiteheads, and even contributes to worsening certain skin conditions like rosacea. Understanding these signals may help in the early detection and treatment of underlying health issues. If you notice any persistent changes in your skin, it's important to consult a healthcare provider to get a proper diagnosis and appropriate treatment. Remember, your skin is the window to your body's health. Today, we learned about all the signs that your skin is showing regarding your health. But did you know that there are other signs that your health might be at risk? Want to find out more? Watch 12 early warning signs your kidneys are in danger of failure. Or watch 8 early warning signs of colon cancer you must not ignore. You may watch either or both of them. Do you know of any other skin issues that were not mentioned earlier? Let us know in the comments section below.